PrEP and PEP are for people who don't have HIV, but they're at risk of getting it. Let's take a closer look at each. Now, let's be clear. There's a big difference between PrEP and PEP. PrEP, PrEP, is for a person who has a sex partner who's HIV, has sex with people and doesn't know their status, or someone who takes injection drugs. On the other hand, PEP is for someone who may have already been exposed, such as during sex, at work to a needle stick or other injury, sharing injection drug equipment, or someone who was exposed maybe due to a sexual assault. PrEP and PEP sound very similar, but they're very different. PrEP, PrEP, stands for pre exposure prophylaxis, whereas PEP, PEP, stands for post exposure prophylaxis. Remember, pre means before and post means after. PrEP is taken every day before possible exposure, but PEP is taken in emergency situations within 72 hours, 3 days, after possible exposure. Let's talk about effectiveness. Used consistently, that means daily. PrEP, PrEP, reduces risk from sex by 99% and from drug injection use by 74%. On the other hand, PEP, PEP, even used consistently, is not always effective. It's important to start it as soon as possible to have the best chance possible of it working. Both are prescribed by a healthcare provider, so call that person as soon as possible. But for PrEP, you can also go to preplocator.org to find someone who prescribes it. For PEP, you might want to go to an urgent care facility 72 hours after potential exposure so you can begin taking it immediately. This public service announcement comes to you from the Central Jersey Alumni Chapter of Delta Sigma Theta Sorority, Incorporated.